Understanding Anxiety Disorders, a comprehensive guide. Anxiety disorders, a group of mental health conditions characterized by excessive worry, fear, and apprehension, affect millions of people worldwide. These disorders can have a profound impact on an individual's life, often leading to debilitating symptoms that interfere with daily functioning. In this comprehensive article, we will delve into the intricacies of anxiety disorders, shedding light on their origins, classification, dangerous consequences, and real-life examples of individuals grappling with these conditions. Origin of anxiety disorders. To understand anxiety disorders better, we must explore their origins. These disorders often result from a complex interplay of genetic, environmental, and psychological factors. While genetics can predispose individuals to anxiety disorders, environmental triggers, such as traumatic events or chronic stress, can act as catalysts. Furthermore, neurobiological factors play a significant role in the development of anxiety disorders. Imbalances in neurotransmitters like serotonin, dopamine, and gamma-aminobutyric acid, GABA, can contribute to the manifestation of anxiety symptoms. Brain structure and function abnormalities, particularly in regions responsible for emotion regulation, like the amygdala and prefrontal cortex, are also associated with these disorders. Learn more about managing anxiety disorders in our comprehensive course. Classification of anxiety disorders. Anxiety disorders are not a one-size-fits-all condition. They encompass a spectrum of disorders, each with its unique characteristics and diagnostic criteria. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, distinguishes several major categories of anxiety disorders. Generalized anxiety disorder, GAD. Individuals with GAD experience persistent, excessive worry and anxiety about various aspects of life, often without a specific trigger. Panic disorder. This disorder is marked by recurrent and unexpected panic attacks, accompanied by intense physical and psychological symptoms, such as palpitations, sweating, and a fear of impending doom. Social anxiety disorder, SAD. People with SAD have an overwhelming fear of social situations and scrutiny, often leading to avoidance behaviors. Specific phobias. These are intense fears of specific objects or situations, such as heights, spiders, or flying, which can result in significant distress. Obsessive-compulsive disorder, OCD. OCD is characterized by obsessions, intrusive, distressing thoughts, and compulsions, repetitive behaviors that individuals feel compelled to perform to alleviate anxiety. Post-traumatic stress disorder, PTSD. PTSD develops after exposure to a traumatic event and involves symptoms like flashbacks, nightmares, and emotional numbness. Agoraphobia. Individuals with agoraphobia fear situations where escape may be difficult, such as crowded places, which can lead to severe limitations in daily life. Dangerous consequences of anxiety disorders. Anxiety disorders extend beyond mere worry. They can have far-reaching consequences that impact an individual's physical, emotional, and social well-being. Physical health. Chronic anxiety can take a toll on the body, leading to increased risk factors for heart disease, gastrointestinal problems, and compromised immune function. Sleep disturbances, common in anxiety disorders, can exacerbate these issues. Mental health. Anxiety often coexists with other mental health conditions, such as depression. Left untreated, it can escalate into a debilitating cycle of emotional distress. Social isolation. Social anxiety and agoraphobia can lead to isolation and withdrawal from social activities, resulting in strained relationships and diminished quality of life. Substance abuse. Some individuals turn to substance abuse as a coping mechanism for anxiety, which can lead to addiction and further complicate their mental health. Early warning signs. Recognizing the early warning signs of anxiety disorders is crucial for timely intervention. These signs may include excessive worry or fear that is difficult to control, restlessness or feeling on edge, muscle tension, irritability, difficulty concentrating, sleep disturbances, such as insomnia, avoidance of certain situations or places, frequent panic attacks. Risk assessment. Assessing your risk for developing an anxiety disorder involves considering your family history, past experiences, and current stress levels. If you or someone you know exhibits several early warning signs, consider seeking professional evaluation and support. Learn more about managing anxiety disorders in our comprehensive course. Real-life examples. To provide a deeper understanding of anxiety disorders, let's consider more real-life examples of individuals who have battled these conditions. Case studies. Case study: Sarah M's struggle with generalized anxiety disorder. Background: Sarah is a 30-year-old marketing professional who has been grappling with generalized anxiety disorder, GAD, since her teenage years. GAD is characterized by persistent and excessive worry about various aspects of life, including work performance, health, and relationships. Symptoms: Sarah's anxiety manifested as racing thoughts, constant restlessness, muscle tension, and difficulty concentrating. She often feared that something terrible would happen, leading to frequent panic attacks. Treatment: Sarah sought help from a mental health professional who provided her with therapy, including cognitive behavioral techniques to challenge and reframe her anxious thoughts. Medication, prescribed by a psychiatrist, was also part of her treatment plan to manage her symptoms effectively. Progress: Over time, with consistent therapy and medication, Sarah learned to identify triggers and implement coping strategies to manage her anxiety. She also adopted relaxation techniques and mindfulness practices to reduce stress. With the support of her therapist, she developed a structured plan to address her worries and gradually regain control over her life. Case study: John K's battle with panic disorder. Background: John is a 40-year-old teacher who battled panic disorder for several years. Panic disorder is characterized by recurrent and unexpected panic attacks, often accompanied by intense physical symptoms and a fear of future attacks. Symptoms: John's panic attacks were debilitating and made him feel as though he was experiencing a heart attack. Sweating, trembling, chest pain, and a racing heart were common during these episodes. These attacks not only affected his work but also prevented him from pursuing his passion for traveling. Treatment: John sought help from a cognitive behavioral therapist who specialized in anxiety disorders. Through therapy, he learned to identify and challenge the catastrophic thoughts that fueled his panic attacks. Exposure therapy, a technique that gradually exposes individuals to their fears, was also part of his treatment plan. Progress: With time and consistent therapy, John became more adept at managing his panic disorder. He learned relaxation techniques and practiced controlled breathing to reduce the intensity of his panic attacks. As a result, he was able to regain his confidence and gradually resumed his adventures in travel, overcoming the limitations his disorder had imposed. Success stories. Success story 1: Emily H's triumph over social anxiety. Background: Emily, a 25-year-old student, once struggled with severe social anxiety, which made attending classes and interacting with peers nearly impossible. Treatment: Emily embarked on a journey of therapy with a mental health professional who specialized in social anxiety. Through consistent therapy and exposure-based techniques, Emily learned to confront her fears and gradually build her social skills. Progress: Over time, Emily's social anxiety significantly improved. She became more comfortable attending classes, engaging with peers, and participating in group activities. Today, she thrives in her academic and social life, demonstrating the transformative potential of therapy and determination. Success story: Mark P's journey to recovery from PTSD. Background: Mark, a military veteran, battled crippling symptoms of post-traumatic stress disorder, PTSD, after serving in a combat zone. Treatment: Mark's journey to recovery began with the support of a dedicated therapist who specialized in trauma and PTSD. He also connected with a network of fellow veterans who understood his experiences. Progress: With therapy and the camaraderie of his fellow veterans, Mark gradually reclaimed his life. He learned effective coping strategies, managed his symptoms, and developed resilience. Today, he works as an advocate for PTSD awareness and support, inspiring others to seek help and embrace the journey to recovery. These case studies and success stories offer insight into the challenges individuals face when dealing with anxiety disorders and the transformative impact of effective treatments and support systems. They emphasize the importance of seeking help, persistence, and the potential for positive change. Explore our comprehensive course on managing anxiety disorders for more in-depth information and guidance. Conclusion: This comprehensive exploration of anxiety disorders aims to provide valuable insights into their intricacies, enabling individuals, healthcare professionals, and society as a whole to better understand and address these prevalent mental health challenges. Remember, help is available, and recovery is possible with the right resources and determination. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, Get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.